A spondyloarthritis is a type of inflammatory arthritis that mainly affects the spine. So there are a number of different types of arthritis, and what rheumatologists deal with mostly are those where the immune system has gone slightly wrong and is starting to cause inflammation in the joints. So the one most people have heard of most is rheumatoid arthritis, but a spondyloarthritis is a similar condition, but people get inflammation in the spine as well as other joints such as the hips, sometimes the hands and feet, and it goes on to cause symptoms such as pain, stiffness in the joints, and sometimes swelling in the joints as well. So with most rheumatological conditions, the causes are quite complicated, actually. Partly it's related to genetics. So we know that some people have an inherited tendency to develop these conditions, but having the genes isn't enough. And often there can be some sort of trigger which sparks it off. The one that's been most well described is where people get a certain type of infections, such as food poisoning, which can spark off the condition to start in the first place. But we also find that there's a lot of overlap with spondyloarthropathies and other conditions such as psoriasis, which is a skin disease, and inflammatory bowel disease such as Crohn's disease or colitis, and also some types of eye disease, inflammation in the eye. So we find these things cluster in families, that one person might have psoriasis and another person might have a spondyloarthritis, for etc., or there might even be a cousin with Crohn's disease. So these little bits of information are really helpful when we're assessing someone to find out what type of arthritis they have. So the warning signs that someone might have a severe type of the condition is largely related to other factors such as the age it comes on. So if it comes on at an early age, such as a teenager or early 20s, we know that it's likely to be a bit more severe than someone who develops the condition in their 30s or 40s, for example. A really strong family history, so a father or mother or perhaps an uncle with these conditions suggests that people have got a lot of the genes that make it more likely. And equally, sometimes other conditions such as Crohn's disease or psoriasis, if someone has those, then it can suggest that they're likely to have a more severe type of the condition. The main symptoms of a spondyloarthritis are pain and swelling and stiffness. So not everyone gets swelling, but if, for example, a knee swelled up or joints in the hands swelled up, that would be a very strong pointer. But the main symptoms are really pain and stiffness in the back and the spine, often at the lower part of the spine. People describe what we call early morning stiffness, which is where they wake up in the morning, sometimes in the early hours, like 3 or 4 o'clock in the morning, with a lot of pain down the bottom of the spine and around the hips. And that gradually improves as people get moving. So they might get up out of bed, slowly move around, and after an hour or two, things will start to improve. Obviously, if there's other things like rashes or tummy upsets that might suggest other conditions going on with it at the same time, that would be important to recognize. So spondyloarthritis can affect lots of different parts of the body. The name spond comes from the Greek meaning spine. So we know that most, if not all, patients experience pain in the spine, but it can affect other joints like the shoulders, the knees, the ankles, the hands, for example. And in addition to that, it doesn't just affect the joints, it can affect tendons as well. So some people get a pain in the Achilles tendon, which can occasionally be swollen and certainly tender, but also conditions like tennis elbow or a bursitis around the hips are quite common. So people have these tender points over the muscles and tendons, which are part of the condition. We have to be aware that because these are conditions where there's inflammation, over a long period of time, the condition can start to cause damage to the joints. And that's really where the treatments that we use are targeted, to try and damp down the immune system to prevent this sort of damage from happening. Spondyloarthritis is treated in a variety of different ways. So as a rheumatologist, I work closely with the multidisciplinary team, particularly the physiotherapists. We know that these types of arthritis respond to exercise. So moving the joints, stretching the spine, stretching the joints, strengthening the muscles is all very, very important. And the physiotherapist can advise very well on the treatments for an individual patient, sometimes involving hydrotherapy, which is exercising in water. When we come on to medications, most people get quite a bit of benefit from simple anti-inflammatory drugs, such as ibuprofen or naproxen, or some of the stronger drugs, which are a bit kinder on the stomach, like etoricoxib, celecoxib. So these are all what we call non-steroidal anti-inflammatory drugs, and they treat the symptoms. Moving on from that, there are some other more complicated drugs that work through the immune system. There are some old-fashioned drugs like methotrexate and sulfasalazine, which we use in certain circumstances. But in modern practice, the biologic drugs, which are clever, expensive, targeted medications, usually given by injection, that target certain molecules such as TNF, which is responsible for a lot of the inflammation. So these biologic drugs are given by injection, sometimes once a week, once a fortnight, depending on which drug. And they're very powerful at controlling the inflammation. And so by relieving people's pain and stiffness and generally making people feel a lot better.